Hi, I'm Dr. Stuart Isaacson, Director of the Parkinson's Disease and Movement Disorder Center at Boca Raton. And I want to thank you for joining us today to talk about NOURIANZ, or istradefylline, and an alternative mechanism to treat Parkinson's disease. This is a promotional presentation on behalf of Kyowa Kirin, and I am here today as a paid consultant of Kyowa Kirin. NOURIANZ is an adenosine receptor antagonist indicated as adjunctive treatment to carbidopa-levodopa in adult patients with Parkinson's disease experiencing OFF episodes. Throughout, we'll talk about important safety information and hear from the warnings and precautions. Dyskinesia, NOURIANZ in combination with levodopa may cause dyskinesia or exacerbate pre-existing dyskinesia. In clinical trials, 1% of patients treated with either NOURIANZ 20 milligrams or 40 milligrams discontinued treatment because of dyskinesia compared to 0% for placebo. In Parkinson's disease, there's more to consider than dopamine. There's also adenosine. Adenosine is a neuromodulator that regulates neuronal excitability. Adenosine A2A receptors are found in the striatum and also globus pallidus externa and related areas. And these receptors, these A2A receptors, regulate the indirect pathway. And activation of these receptors reduces motor activity. As Parkinson's disease progresses, striatal dopamine is lost, of course, but also adenosine A2A receptors in the striatum may increase. Now, we look at the cartoon of these pathways. In normal movement, we have a balance between the outflow of the indirect and direct pathways. These pathways are made up of projections from the medium spiny neurons in the striatum. Those medium spiny neurons that can have dopamine D2 receptors make up the indirect pathways, and those with D1 receptors make up the direct pathway. And these are balanced in normal brain, and it can be noted that on the indirect pathway neurons, in addition to having the D2 receptors, they also have adenosine 2A receptors. In Parkinson's disease, there's this depletion of dopamine being delivered from the nigral neurons to the striatum. A consequence of this is less activation of both the D1 and D2 receptors. This results in a reduced outflow of the direct or GO pathway and an increased outflow of the indirect or STOP pathway. And the combined result is less movement or bradykinesia. Also note, though, that there's an upregulation on the indirect pathway neurons of adenosine 2A receptors. When we think about treating our patients in Parkinson's disease with levodopa during OFF episodes, and they have OFF episodes when they're being treated with levodopa very commonly, and as you lose striatal dopamine, these activated adenosine 2A receptors have a braking activity on the normal outflow from the indirect pathway. And what occurs is that while we have with levodopa a better outflow from the direct or GO pathway and less stop from the indirect pathway, there's still a braking or stopping activity from the indirect pathway due to this upregulated overactive adenosine 2A receptors. So when we think about trying to address OFF episodes, in addition to giving levodopa, we can also give an adenosine A2A receptor antagonist to block these upregulated or overactive receptors and further reduce the outflow of the indirect or STOP pathway, improving movement. And in this way, adenosine A2A receptor antagonists may help to regulate these indirect and direct pathways and the balance between them to try to facilitate movement and improve OFF episodes. In essence, it's like a brake on the system. The role of dopamine is like a gas, pushing on the gas, stimulating D1 and D2 receptors and initiating movement. And adenosine acts as a brake on the system. So if you went in a car and you try to drive with the emergency brake on, it might go forward, but then when you release the emergency brake, it moves much more freely. So in this analogy, adenosine is like the brake. Now, NOURIANZ, or istradefylline, is the first and only adenosine 2A receptor antagonist for Parkinson's disease. So NOURIANZ, istradefylline, is the first and only adenosine A2A receptor antagonist for Parkinson's disease. It has a novel structure depicted here on the slide. And while the precise mechanism by which istradefylline exerts its therapeutic effect in Parkinson's disease is not known, we think it has to do with a highly specific affinity for the adenosine A2A receptor. Now, it also has no affinity for dopamine or other receptors. It has a novel non-dopaminergic mechanism of action that works differently than other treatments we've considered for Parkinson's disease. This novel structure also has a long half-life of about 83 hours, which lends itself to once-a-day dosing. So important safety information to be aware of, warnings of cautions. Because of the potential risk of exacerbating psychosis, patients who have major psychotic disorder should not be treated with NOURIANZ, and to consider a dosage reduction or discontinuation if a patient develops hallucinations or other psychoses while taking NOURIANZ. NOURIANZ was evaluated in 4 randomized 12-week multi-center double-blind placebo-controlled studies investigating 20 milligrams and 40 milligrams of NOURIANZ as adjunctive treatment to levodopa in patients with Parkinson's disease experiencing off time. In these studies, the mean off time on entry to the studies is about 6 hours per day. Patients who are on other therapies, in addition to baseline levodopa carbidopa, had to be on stable doses for 30 days prior to the trial and throughout the trial. These included dopamine agonists, COMT and MAO inhibitors, anticholinergics, and amantadine. The primary endpoint was a percentage of daily awake off time in the U.S. studies 1 and 2, and total daily off time in the Japanese studies 3 and 4. In all 4 of these studies, secondary endpoints included a change from baseline and on time without troublesome dyskinesia. Some important safety information also to be aware of is that patients treated with NOURIANZ and 1 or more medications for the treatment of Parkinson's disease, including levodopa, may experience impulse control or compulsive behaviors. And in the clinical trials, 1 patient treated with NOURIANZ 40 milligrams was reported to have impulse control disorder compared to no patient on NOURIANZ 20 milligrams or on placebo. In these studies, we saw a reduction in off time across all 4 of the trials. Here we can see, compared to placebo, both NOURIANZ 20 milligrams and 40 milligrams had a significant improvement over placebo. And here we have the p-values of 0.002 to 0.05 throughout the trials. And this was about a delta improvement in hours between 0.65 hours and 1.16 hours. To be recognized drug interactions and important safety information that the maximum recommended dosage in patients in general is 40 milligrams, but in those taking a strong CYP3A4 inhibitor is 20 milligrams once daily, and the use of NOURIANZ should be avoided in patients on strong CYP3A4 inducers. Safety and tolerability. The incidence of adverse reactions seen in 2 or more % on either dose of NOURIANZ and greater than placebo are listed here in pooled data from 4 trials, dyskinesia being the most common adverse reaction seen over placebo. Other side effects that are listed here on the slide that were more than placebo included constipation, nausea, hallucinations. And you can see the percentages difference compared to placebo, NOURIANZ 20 and 40 milligrams. Please see additional important safety information throughout and on slide 13, and please see accompanying full prescribing information. Treatment emergent adverse reactions of special interest are depicted on this slide. Orthostatic hypotension occurred at 5.4% of patients on placebo, 6.7 or 6.9% on NOURIANZ 20 and 40 milligrams. We can see here the incidence of falls and nausea and vomiting. Hallucinations were 2.8%, 2.2% at 5.8% on the 40 milligrams NOURIANZ. Point out here impulse control disorder we mentioned earlier. Now that 1 patient on the NOURIANZ 40 milligrams, neutropenia 0.3% on 20 milligrams, 0.5% on 40 milligrams, wasn't seen on placebo. Similar incidences, a bit higher on placebo for liver enzymes as well. So we think about NOURIANZ for patients who have Parkinson's disease and are experiencing off episodes while on carbidopa-levodopa, I think there's several things to keep in mind. NOURIANZ is the first and only non-dopaminergic adenosine A2A receptor antagonist for adjunctive treatment in patients with Parkinson's disease with off episodes. It's one pill, once a day, with or without food. It's available in a 20 milligram, which is the initial starting dose in most patients, and 40 milligrams. Initial dose titration, though, is not required. No adjustment of NOURIANZ dosage is recommended on the basis of age. The most common adverse reactions that were seen in 5 or greater % of patients on the 20 or 40 milligram dose versus placebo and greater than placebo were dyskinesia, dizziness, constipation, nausea, hallucinations, and insomnia. Kyowa Kirin, who markets this drug, has programs through the Kyowa Kirin CARES. They wear their copay cards for patients who are eligible. They can check on the phone and on the website to check their eligibility. Patients can obtain NOURIANZ from the CVS or Walgreens specialty pharmacy, and there's a number of programs available to try to help patients have access to this medication if prescribed to them. NOURIANZ indication is as an adenosine receptor antagonist that's indicated as adjunctive treatment to levodopa-carbidopa in adult patients with Parkinson's disease experiencing off episodes. Important safety information, the warnings and precautions to be aware of. Dyskinesia, NOURIANZ in combination with levodopa may cause dyskinesia or exacerbate pre-existing dyskinesia. In clinical trials, 1% of patients treated with either NOURIANZ 20 milligrams or 40 milligrams discontinued treatment because of dyskinesia, compared to 0% for placebo. Hallucinations, psychotic behavior, because of the potential risk of exacerbating psychosis. Patients with a major psychotic disorder should not be treated with NOURIANZ. Consider dose reduction or discontinuation if a patient develops hallucinations or psychotic behaviors while taking NOURIANZ. Impulse control or compulsive behaviors. Patients treated with NOURIANZ and one or more medications for the treatment of Parkinson's disease, including levodopa, may experience intense urges to gamble, increased sexual urges, intense urges to spend money, binge or compulsive eating, and or other intense urges, and the inability to control these urges. In clinical trials, one patient treated with NOURIANZ 40 milligrams was reported to have impulse control disorder, compared to no patient on NOURIANZ 20 milligrams or placebo. Drug interactions. The maximum recommended dosage in patients taking strong CYP3A4 inhibitors is 20 milligrams once daily. Avoid use of NOURIANZ with strong CYP3A4 inducers. Specific populations, pregnancy based on animal data may cause fetal harm. Hepatic impairment. The maximum recommended dose of NOURIANZ in patients with moderate hepatic impairment is 20 milligrams once daily. Avoid use in patients with severe hepatic impairment. Adverse reactions. The most common adverse reactions with an incidence greater than or equal to 5% and occurring more frequently than with placebo were dyskinesia, 15%, 17%, and 8%. Dizziness, 3%, 6%, and 4%. Constipation, 5%, 6%, and 3%. Nausea, 4%, 6%, and 5%. Hallucinations, 2%, 6%, and 3%. And insomnia, 1%, 6%, and 4%. For NOURIANZ 20 milligrams, 40 milligrams, and placebo, respectively. You are encouraged to report suspected adverse reactions to Kyowa Kirin at this phone number here or to the FDA at the phone number or website. Please see full prescribing information for NOURIANZ as well. NOURIANZ resources are available. A number of different websites can be contacted to find out more information about NOURIANZ, its mechanism of action, as well as its prescribing information, and also resources for patients that can help describe how NOURIANZ works, as well as a patient brochure and access and patient support and a patient PI.